Hello and welcome to Kapnick Strive's May webinar. My name is Lexi and I will be one of your presenters today. I'm also joined by your other presenters, Emma and Jen. And today we will be discussing the fascinating topic of allergies, a common health concern that affects millions of people around the world. In fact, allergies are among the most prevalent chronic health conditions worldwide. It's worth noting that if you have a family history of allergies, you may have a higher chance of developing allergic diseases yourself. This familial link can make some individuals more prone to experiencing allergies. But what exactly is an allergy? Well, it's a response triggered by our immune system when it encounters a foreign substance that would normally be harmless to our body. And these foreign substances are known as allergens and can include certain foods, pollen, or even pet dander, which refers to those tiny particles or skin or fur shed by our loving pets. The good news is that there are several treatments available to help manage and alleviate allergy symptoms. Later in our presentation, we will discuss these treatments in more detail, equipping you with valuable knowledge on how to mitigate the impact of allergies. And understanding the causes and symptoms of allergies empowers us to take control of our health and our well-being. And by staying informed and exploring effective treatment options, we can effectively manage allergies and improve our quality of life. So now let's embark on a journey to unravel the complexities of allergies and discover strategies to navigate this common health concern.
Hi everyone, Jen here. And as Lexi shared, allergies are relatively common and affect a significant portion of the population worldwide. In fact, more than 100 million people in the US experience various types of allergies each year. So much so that allergies are the 6th leading cause of chronic illness in the US. Now, awareness and diagnosis of allergies has improved over time, and that could contribute to the higher reported numbers. And often when we think of allergies, the common ones that come to mind, Lexi mentioned a few of these already: food, pollen, pets, insects, allergies to medications or certain materials like latex. And while allergies are commonly seen in children, it's important to note that they can occur for the first time at any age or even resurface after a long period of remission. Since allergies affect people of all ages, races, genders, socioeconomic backgrounds, this is a universally important topic. It is important to note that the prevalence of allergies can vary depending on the specific allergen, geographic location, and population of demographics. So for instance, you may not experience hay fever if you live in an area where there is not a lot of pollen. So again, it's really widespread on what and who can be impacted, and knowing your surroundings is an important part of that. If you think that you are having an allergy or experiencing a symptom, we definitely want you to speak with a healthcare professional and make sure that you get properly evaluated, and we'll talk about that in a bit.
Thanks, Jen. Now that we know what allergies are and how common they are, let's dive into allergies and the immune system. So the immune system is like a superhero that protects our body from germs and other bad things that can make us sick. It's made up of a special network that keeps out bacteria, viruses, fungi, and harmful substances and fights off any infections that try to invade our bodies. Sometimes when certain harmless things like dust, mold, or pollen come in contact with someone who's allergic to them, their immune system gets confused and starts to attack those things. And this can cause problems like sneezing, inflammation, and other symptoms we'll talk about later. Common allergies like hay fever, asthma, and hives are linked to something called immunoglobulin E, or IgE antibodies, that our body makes. And each antibody is like a special soldier that goes after specific allergens, like certain pollens or other things that can make us sneeze or feel itchy. It's possible to be allergic to one type of pollen, but not another. And when a person with allergies encounters an allergen, their body makes a lot of the same antibodies. If they come into contact with that allergen again, they can have an allergic reaction. And the symptoms of the reaction depend on the type of allergen and how the body's immune system reacts to it. You gotta love the human body, right? So normally our immune system knows how to adjust to the things around us. So for example, when our body encounters things like pet dander, it should understand that they are harmless. But in people with allergies to pet dander, their immune system thinks it's a dangerous invader and tries to attack it. As Jen said earlier, allergies affect people of all ages, regardless of their gender, race, or socioeconomic background. Various factors can influence the development or severity of allergies. Hormones, stress, exposure to smoke, perfume, or environmental irritants may all play a role in triggering or aggravating allergic reactions. So now let's talk about these allergens, the substances responsible for setting off these allergic responses. Some of the most common allergens, as Jen mentioned earlier, include medications, insect stings, latex, mold, pet dander, which is again that fur or skin flake shed by pets, pollen, or certain types of food. Really understanding allergies and their triggers is vital in managing and addressing the allergic reactions. And again, by raising awareness and gaining knowledge about these factors, we can take steps to mitigate the impact of allergies have on our lives. So now let's talk about the various symptoms associated with these allergies. It's important to be aware of the wide range of symptoms that can occur during allergic reactions. And these symptoms, again, can vary from person to person and even differ in the same individual over time. One of the most common symptoms experienced during allergies is watery eyes, where tears may flow more than usual. Sneezing is another familiar symptom, that sudden involuntary expulsions of air that we get through the nose and mouth, and a runny nose with clear or thick discharge, which is also commonly observed. If you have allergies, you know these symptoms all too well. Some skin-related symptoms are quite common. So rashes, which are those red, itchy patches on the skin, and hives, which are raised, swollen bumps, are frequent indicators of an allergic reaction. Eczema, a condition causing dry, itchy, and inflamed skin, may also be associated with those allergies. Asthma, a respiratory condition that leads to difficulty breathing, wheezing, and coughing, can be triggered or worsened by allergies. And some individuals may also experience specific food allergies when consuming certain foods can lead to those allergic reactions. Another well-known allergic condition is hay fever, also referred to as allergic rhinitis. It involves symptoms like sneezing, itchy, congestion, and a runny or stuffy nose, often triggered by airborne allergens like pollen. And it's essential to be mindful of the potentially severe allergic reactions known as anaphylaxis, which can be life-threatening if not treated immediately. We will discuss this further in the next slide.
Thanks, Lexi. Anaphylaxis is a severe and potentially life-threatening allergic reaction. Anaphylaxis requires immediate medical attention. So here are some of the signs and symptoms that can develop rapidly and typically within seconds to minutes after exposure to an allergen. Skin reactions, those itching, hive, flushed, or pale skin. You may also see swelling of the lips, tongue, throat, face, or other parts of the body. Respiratory issues, that's the difficulty breathing, wheezing, shortness of breath, or persistent coughing, tightness in chest. Cardiovascular issues can also be a sign of anaphylaxis, where you have a rapid heartbeat or a low blood pressure, dizziness, lightheadedness, or fainting. Gastrointestinal symptoms can also be seen: nausea, vomiting, abdominal pain, diarrhea. There's also a symptom of feeling of impending doom. So some individuals may have a sense of anxiety or apprehension or impending disaster when they are experiencing anaphylaxis. And then throat tightness, a feeling where your throat is feeling constricted or tight, can also be a symptom of anaphylaxis. It's very important. Not all symptoms can be present in every case of anaphylaxis, and symptoms can vary from person to person. Either way, it is a medical emergency. So if you suspect someone is experiencing anaphylaxis, it's crucial to call emergency services immediately and seek medical attention. Speaking of seeking medical attention, when should you see a doctor? If you're having an experience with allergies and you're uncertain about the severity or the impact on your health, it's generally advisable to consult a doctor. The following situations where seeking medical attention is what we recommend. So if your symptoms are becoming more severe or worsening, if they are rapidly worsening, affecting your breathing, that's definitely a time when you want to see your doctor, check in. If you suspect you're experiencing any form of anaphylaxis, this is also an important time to see your doctor or seek medical attention. As we mentioned in the last slide, there are a lot of very severe and life-threatening issues that can come along with that anaphylaxis. Another time to check in is if your symptoms are persisting for an extended period of time. So if they're becoming really chronic, that could be nasal congestion, sneezing, or itching eyes. Allergy related complications. So if you are finding that you are having chronic sinus infections because of your allergies, or ear infections, or your asthma is much worse during allergy exposure, those would be allergy-related complications and another time to check in with your medical provider. If the allergy is interfering with your daily life, significantly impacting your quality of life, disrupting your sleep, causing you chronic discomfort, or impacting your ability to work and engage in regular activities, again, we'll talk about some of the treatments that your doctor can recommend, but checking in with your physician is a good first step to getting that where you're not so uncomfortable all the time. Allergies in children, they can be experienced differently than adults. So again, checking in with the pediatrician for your child if they're exhibiting allergy symptoms or experiencing an allergic reaction is recommended. And hey, remember, a health professional is the best person to equip to diagnose and provide appropriate treatment for allergies. They can help identify what specific allergen is causing your symptom, offer guidance on how to avoid that allergen, prescribe medications, recommend further testing and immunotherapy if necessary. So allergies are typically diagnosed through a combination of medical history, physical exams, and specific diagnostic tests. The common methods used for diagnosing are as followed. Medical history. So that's the first step where you'll discuss your symptoms and your medical history with your healthcare provider. They'll ask you about the nature of your symptoms, the duration, triggers or patterns that you've recognized. They may also ask about family history, since there can be a genetic predisposition for allergies. You'll also see a physical exam as part of a diagnosis process. This can be performed to evaluate any visible signs of allergic reaction, rashes on your skin, nasal congestion, wheezing, etc. And Emma is going to dive into more on what diagnostic testing looks like.
Thank you, Jen. So healthcare providers perform allergy tests to determine whether your immune system overreacts to certain substances, those allergens. So if you have an allergic reaction, it means you have an allergy. Your healthcare provider may perform an allergy test if you have allergy symptoms that bother you, if you have asthma, or if you've ever experienced allergic anaphylaxis. So what does an allergy test do? Allergy tests measure your body's response to specific allergy triggers or allergens. If you have an allergy, your immune system overreacts. It produces antibodies, those immunoglobulin E antibodies that Lexi was talking about earlier. So those antibodies trigger the release of chemicals that cause the allergic reaction. Now, there are different ways to test for allergies. Your healthcare provider will select the best method based on your symptoms and the suspected allergens. These tests can include the skin prick or the scratch test. In this test, your provider uses a thin needle. I've had this done, I promise you barely feel it. A thin needle to prick the skin on your forearm or your back with 10 to 50 different potential allergens. Or your provider may place droplets of potential allergens onto your skin and then use a device to scratch and lightly puncture the area, causing the liquid to enter your skin. So reactions such as redness typically occur within 15 minutes of exposure. Your reaction might be a rash or a raised round spot called a wheal. This test checks for airborne allergies, food allergies, and also penicillin allergies. Similarly, there's the intradermal skin test. So you might get this intradermal skin test if the skin prick test results are negative or inconclusive. In this test, your provider injects small amounts of the allergen into the outer layer of your skin. And this test checks for allergies to airborne irritants, medications, and insect stains. There's also the patch test. So this test determines the cause of contact dermatitis. So if one of your symptoms is a lot of skin rashes in response to brushing up against something, this is a test to determine the allergen for that. So in this test, your provider places drops of an allergen onto the skin on your arm and covers the area with a bandage. Or your provider may apply a bandage that has the allergen already on it. You leave the bandage on and return to the provider's office within 48 to 96 hours. So it's a little bit longer of a test, but then your provider removes the bandage when you return and they check your skin for a rash or other reaction. Next up, we have the blood test. Or the IgE, that immunoglobulin E test. So in this test, your provider sends a sample of your blood to a lab. The lab adds allergens to the blood sample and measures the level of antibodies in it. These blood tests can have a higher rate of false positive results, but this is something that you should talk to your healthcare provider about. And then lastly, we have challenge tests. So this test occurs only under a provider's direct in-person supervision. Please do not try this at home. But people with a suspected food or drug allergy in this test, they ingest a small amount of the allergen. An allergist typically performs this test. Medical supervision is a must. If you suspect that you're allergic to peanuts, it's not recommended that you eat a peanut at home without medical supervision if you think you're allergic to peanuts. So like I said, medical supervision is a must. If you develop anaphylaxis, the provider quickly gives an epinephrine injection to stop the reaction. I do want to make a small note here. Over-the-counter allergy test kits do exist at local drugstores. You can buy them online. However, they're not very reliable, and some of them don't test for the right antibodies. You're also a lot more likely to get a false positive result, which may lead you to avoid certain substances or foods unnecessarily. So it's important that all of these discussed diagnostic methods be conducted under the guidance of a healthcare professional, such as an allergist or an immunologist, who has expertise in diagnosing and managing allergies. They will interpret the test results, consider your symptoms and medical history, and provide an accurate diagnosis. Now, because there are so many different allergens and allergic symptoms, there are a number of different allergy treatments. If you've ever suffered from allergies, I'm assuming you've already had experience with plenty of these. So first up, is just allergen avoidance. So your provider will help you take steps to identify and avoid your allergy triggers. This is generally the most important step in preventing allergic reactions and reducing symptoms. This can look like, if it's a food allergy, obviously avoiding that food, but it can also look like avoiding the outdoors during certain times of the year. It can look like closing the door on your cats at night if you're allergic to your cats, keeping them out of your bedroom to help just minimize and avoid those allergens. Another form of treatment is medication. So depending on your allergy, medications can help reduce your immune system reaction and ease symptoms. Your provider might suggest non-prescription or prescription medication in the form of pills, liquid, nasal sprays, or eye drops. Up next, there's immunotherapy, and this is for severe allergies or allergies not completely relieved by other treatment. Your provider might recommend allergen immunotherapy. This treatment involves a series of injections of purified allergen extracts, usually given over a period of 2 years. So this is slowly building up your immune system so that it no longer attacks the allergens. Now, another form of immunotherapy is a tablet that's placed under the tongue until it dissolves. These sublingual drugs are used to treat some pollen allergies. And then lastly, there's emergency epinephrine. So this is for people with a severe allergy. They will need to carry an emergency epinephrine shot at all times. This is given for severe allergic reactions. The EpiPen or the epinephrine shot can reduce symptoms until you get emergency treatment. And as always, consult with your doctor before beginning any treatment regimen, whether it is over the counter or not. Now, wrapping up our presentation, we have a quick reflection question or two to ask yourself about allergies. So go ahead and ask yourself, how could my life be different if I managed my allergies? I know that there's a lot of folks out there who tend to just suffer through, suck it up until the next season. But how could your life be different if you managed your allergies? And what would it look like if you didn't? So take some time, you can reflect on those questions. And if you are interested in any further learning, there are some resources on this slide. So I'm just going to run through them one by one. The Allergy Solution. So this book discusses immune imbalance, gut health, and some other root causes of allergies, and offers healthy diet and lifestyle behaviors that can help manage those allergies. Daniel Has an Allergy. This is a book made to help children, particularly young children or toddlers, learn about their own food allergies and how to manage them. Up next, we have the Itch podcast. So this podcast is hosted by Courtney, who is a woman who lives with multiple food allergies, asthma, eczema, and Dr. Payal Gupta, who is a triple board certified doctor who works in New York City. So these women discuss allergies, asthma, and immunology in an uncomplicated way, and they have all kinds of topics. So definitely check out that podcast if you are someone who is allergy affected. And then lastly, we have a PBS documentary called Food for Thought. This is a free documentary. If you would like to watch it, you can go ahead and scan that QR code and it will take you right to the page to watch. But this documentary is just talking about how food allergies have become more prevalent over the past few decades and the causes for that. Thank you very much for joining our monthly webinar, and we look forward to seeing you next month, where our topic is children's mental health. This will be happening on June 28th from noon to 12:30 Eastern Standard Time. If you would like to register for that webinar, go ahead, scan the QR code on the slide, and sign up.